I think it is clear to believe in the power of ideas.
Fresh thinking with the Manhattan Institute.
Thank you. Thank you, Steve and Tarren. Just a little help on page 17 in your booklet and page 18 in the booklet. The 18 is Appendix 1, and it has the data that Stephen cited to help you get the numbers to understand how they got to the 37% number. The other thing is to reiterate the market that we're talking about. This is the direct pay market, which is understood as the residual market for Americans who do not obtain coverage from their employer or qualify for public programs. They're largely young, healthy, without dependents, above the poverty level, with over 60% earning over $25,000 annually, and 1/3 earning over $50,000 annually. This is the group that we're talking about, the direct pay market. In response to this excellent presentation, I'd like to ask Peter Newell to respond.
Thank you, Bill. Although I'm sorry that Jim Nickman couldn't make it today. I know I speak for all of us when I say that I'm glad to see you up here sitting today. It's really nice. I'm from the United Hospital Fund. I'm filling in for Jim Talon today. Jim very much wanted to be here, but he has a commitment in Washington. Who knows what he's doing up there these days? I don't know. But he's always enjoyed our conversations with Tarren and the Manhattan Institute over the years, and the interplay, and I think he's also, always appreciates that, unlike some of the other things you've seen lately, a tone of civility, prevails, even though we sort of bring different ideas to the table. So for that reason, you won't hear me characterizing this plan as one to create sickness panels staffed by big insurance company bean counters with no clinical training and empowering them to review your private medical records and decide whether you'll be pushed into a government-run insurance plan. So thanks, and thanks to the Institute, too, for hosting this event. It's a beautiful spot, and I think a museum is an appropriate place to be discussing these old ideas. So I called this swimming in the tide and against the tide, and EJ mentioned this. There is an emerging consensus in federal health care reform. God knows where it's going, but, as EJ said, it does appear to be moving the rest of the nation towards New York. And there is an increasing body of evidence that does two things. It suggests that subsidies or price reductions alone don't get you universal coverage or near universal coverage. And also, although it might seem counterintuitive, mandates actually are not as much of a cost factor as earlier literature has suggested. I want to just talk about a couple of differences in the way we see the world, and then talk about the model. Although, as I told Bill sort of warned me, don't get into the weeds on this micro simulation, and I said, don't worry, I'm completely incapable of taking anyone into the weeds there. But I will just point out some questions I have, and then get into the specifics of the proposal. Tarren and I do differ on, the individual market and what's there. I think you'll see at the top there's the quote from the paper, and I think the baseline that he talks about in 1994 is based on census data for the individual market, and the 34,000 number is really just what's in the standardized direct pay market. In the next column over there, you see, this year's census estimate of who's in the directly purchased or individual market in New York. you know, it's a number that, you know, people sort of scratch their heads about, but I think if you use 1 for the baseline, you have to use 1 for, you know, what's happening now.